All right. Good evening, everyone, and welcome back to AIMST podcast session, episode 2, with our distinguished delegate. First of all, thank you so much for taking up your time to join the session. And as how the Faculty of Dentistry's podcast session would have benefited those who are watching this session, we believe as how the topic goes for the day, pharmacy and the future of pharmacy in Malaysia, we believe this session is going to give adequate amount of input to those who are viewing this. And without much delay, let's move into the session. All right, so today, before moving into the session directly, we have one of the most remarkable figure of AIMST University who's going to speak about pharmacy program and who's going to deliver the answers that has been lingering around people's perception, I would say. So yeah, without wasting our time, let's move towards our host of the day, Prof. So thank you so much, Prof, for taking our time to join the session.
Yeah, thank you for inviting me there, Dhiren.
I think, Prof, before moving into the session, this is my personal view, Prof. When we speak about pharmacy program itself, definitely looking from the perspective of academician and non-academician, there's a lot of varieties over there. But from the perspective of a non-academician, I think we, in a general people itself, we have obtained quite a lot of information from Prof itself regarding the pharmacy programs over here in AIMST University. So before moving into the question itself, Prof, a small introduction about Prof by yourself. Like, how does the Prof journey start in AIMST University? What's the expansion of the programs and all?
Thank you, Dhiren. I've actually joined the university in 2003, and our pharmacy program started in 2005. So I was there since the inception of the Faculty of Pharmacy, and since then I've seen how the faculty has evolved from having 7 faculty members until 33, and to the extent of graduating 1,261 students over the years. And I can see that, how we have progressed in terms of quality education that we have provided to our students by the evidence that, where our students being placed around the country, and some of them become very much successful entrepreneurs in a pharmacy career, and some of them are being placed in the hospitals, and many of them are already open up their own retail pharmacies and all that. So whenever we have a discussion and talk to these our alumni, we feel that we have the Faculty of Pharmacy in AIMST University. We have contributed so much so to the healthcare section of our country.
Well, that's actually nice, Prof. So from 7 to for the number of staff from 7 to 20. Sorry.
Now currently we have about 32 staff.
32,
faculty,
Prof.
Yeah, faculty members. And initially when we started the program, Dhiren, we had the KPT as well as MQA and Pharmacy Board only allow us to take 50 students. And with the quality of students we produce and the demand of the nation for more pharmacies, we increased the quota to 100. And after that, since then, we maintain to 100 as of 2 years back. Now, the quota has been taken off, which means you can take as many number of pharmacy students as possible, provided you fulfill the staff-student ratio and provided you have sufficient facilities for the students' use.
Right. So which means that we are following the regulation, and at the same time we are expanding ourselves in this program, I guess, Prof. Okay. So, Prof, speaking about pharmacy program, before moving into the typical question that usually parents will be asking us, I think Prof have been there. Prof have been attending quite a number of education fairs and so on. My first question, Prof, why pharmacy?
Okay. I think the awareness about the pharmacies is still lacking, I would say, in general people's opinion. The simple reason is that they don't really understand what the pharmacies do. Okay. Now, if you look into the healthcare section, we have doctors who are actually diagnosing the diseases, and then we have nurses who are taking care of the patients and all that. But in that, holistic approach, the pharmacist's role is that to ensure whatever disease has been diagnosed, there's a proper therapeutical drug being given to address that health issues. So pharmacist's role is not only, dispensing medicine, but they are playing very important role to ensure the pharmaceutical care or the therapeutical care has been given properly to the patient, so that eventually the patient recover from the whatever disease the patient is actually going through. So the role of pharmacies has become very important in terms of the healthcare per se.
So which means that the priority and also the importance of pharmacy program is actually expanding, Prof. Can we put it up in that way?
Oh, yes,
Okay,
definitely.
all right.
When you look at it, the number of pharmacy universities or pharmacy colleges offering pharmacy program is now become many, right?
Okay.
If you look into the pharmacy education landscape in Malaysia, I think initially only public universities are offering the pharmacy program. Now we can see that many, because of the demand, because of the need by KKM and also general public, we see that many institutions now started offering pharmacy program, and that is actually to reach out the probably to give a better health care for the people of Malaysia. Yeah.
Okay. The main reason, Prof, why we put forward this question is perhaps we can't say this as a myth, because this is something that has been running among the people's perception and all.
Yeah.
Pharmacy, the whole tagline, Prof, it has always been MBBS or else dentistry or else pharmacy. So why does this whole speculation happen, Prof? Why pharmacy is being labelized as a third options, fulfilling after my first or second options? Or do Prof see that actually it's a kind of a myth where the pharmacy actually plays an equivalent role like how a MBBS requirement has been, dentistry requirement has been? Why, Prof? Why this? That
yeah, I think that's a general perception of people. When they say about the program related to healthcare, they will label MBBS first, dentistry second, third is pharmacy. Students apply for MBBS. If they don't get MBBS, then they'll go for the
exactly.
Yeah, so this is the perception. But if you look into the data that we have, the students enrolled into our program, those students coming into our Bachelor of Pharmacy program, they are equivalently as good as all the medical students or dentistry students. They are actually 9A plus students, 10A plus students in their SPM. They also score 4 CGPA, 4 flat in their STPM and matriculation and all that. So the thing is that probably the awareness about the program, is not really there, and that's why people think that it is being placed at the third rank in terms of the healthcare program that is being offered. But in actual scenario, when you look at it, with the way that nation is progressing, the way the healthcare sector demand, I think pharmacist's role, you cannot replace with any other profession. So they have their very much oriented way of delivering to the healthcare section per se. So now I think the people perception is that it is being labeled as a third level, but actually it is not.
It is not. It definitely is not.
It is not. Yeah.
Because perhaps, Prof, we will say maybe the as Prof said, which is that the realization of the importance is not as strong as how it is being for MBBS and dentistry. So in that case, we will say like maybe students are more exposed towards this pharmacy, what they call this pharmacy around us and so on. There's another kind of a misconception, Prof, which is that when you choose pharmacy program, the maximum level that you can land is working in a pharmacy. So this eventually pulls down the reputation of the program, and eventually it gives a wrong signal towards people out there saying that my career expansion when it comes to pharmacy program is not as strong as how it goes towards the other two programs. So what would your say be, Prof?
Okay, I think we need to clear the air. First of all, of course, when you talk about becoming a pharmacist, they will end up dispensing medicine, maybe in a retail pharmacy, or maybe that they may be working in a government hospitals where you have a pharmacy counter. The pharmacists are working there, but that is not limited to that only. Pharmacist's role has been expanded over the years. Right, so now we see pharmacists are actually working in regulatory affairs. There are pharmacists working there. Right. We also have industry like pharmaceutical industries. It's been developing so rapid that you need to have pharmacists, to be there, to look into the quality control aspect, the drug development process, and so on. And we also see that, pharmacists are also becoming, academician, like us. That's also career path in academics. And pharmacists are also involved in sales and marketing of the drugs. All right. So it is better to listen from pharmacists who knows everything about the drugs.
Exactly, Prof.
Yeah.
Yeah.
So
exactly.
rather than someone who does not have any understanding of the drugs and what is the effect of the drug and all that, when they become a salesperson, so it is better to listen from the pharmacist. So pharmacists also being an important or integral part in sales and marketing of the drugs. And we also see that there are veterinary pharmacy. Also be taking place. All right. And we also have pharmacies. Of course, they're working in retail and community pharmacies. And beyond that, pharmacies are also involved in research and development. All right. So we cannot limit the pharmacies just dispensing medicine, sitting in one counter. No, it is not like that. Like, when you look into the, diseases, which is like, coming out, in a rapid manner, what you see previously, the diseases, now you see new diseases are coming up. So we need to find a solution, or you need to find a medication for that. So the pharmacies are the ones who are actually involved in research and development to find a solution for these new diseases.
Prof, sorry to interrupt. Can we put it up in this way, which is that pharmacy is the backbone of the whole medical industry?
Well, that is a difficult terminology that we would like to use, but I would say that pharmacies they are actually part of the medical industry, backbone of the medical industry, alongside with the medical doctors and nurses and probably dentists and all that.
So which means that all these parties has to come together, and eventually it means that all these parties carries a significant importance over there.
Yes. You see, when we talk about giving a proper or full health care for the people, you cannot depend only on medical doctors, because medical doctors, they will diagnose. Of course, they will, find out what is the cause for the disease and all that. But you need to have the pharmacist's input so that they can get a better understanding on what type of medicine that or drugs can be, given to the patient, so that we can have a holistic pharmaceutical care approach, so that we have a better outcome of that particular patient's in terms of a medical condition. So in another way, I can say that the pharmacist's role become very much integral in our healthcare system.
Okay, Prof, if let's say I think I will pick from the statement that Prof have just used, which is that the importance of pharmacists in this medical role. Coming back to the same question, Prof, when we put forward a situation which is that the number of graduates that the nation is producing, right from the government sector or private sector, Prof, are we actually meeting the demand of the pharmacists in the nation, or we are going to come out with the term oversupply?
Well, I think there is a stipulation by WHO, World Health Organization, that for every developed country there is a population to pharmacist ratio. So that the ratio is 1 to 1,000. Now, if you look into our current situation in the country, we have not reached that population to pharmacist ratio yet.
So which means
there is a need for pharmacies. Okay. And to say that pharmacies are saturated, looking into the number of programs offered by pharmacy colleges in the country, no, it is not right. Because if you look at it, of lately there are a lot of retail pharmacies are blooming. But it doesn't mean that we already have a more supply of pharmacies. We still do need more pharmacies to be appointed in the government hospital. We need pharmacies to be appointed in regulatory affairs. We need pharmacies to cater the need of a population in the retail sector. So, and in fact in manufacturing also, a lot of manufacturing companies are in need of the pharmacies. So to say that the pharmacies numbers are saturated in the market, I think it is not right.
It is definitely not meeting the requirement, right, Prof?
Yes.
Okay, Prof. So when we look into meeting up the requirement for Prof being in this whole industry for the last 24 years plus and so on, Prof, how do Prof see the whole situation 10 years back, right now, and down the lane? Which means that in future, what will be the situation of country and what will be the demand of pharmacy program or pharmacies in our nation, Prof? Before moving into the globe spec and so on, how does the requirement and how is the demand is going to be back in our nation?
I think there's always a demand. As long that that healthcare system exists, there's always going to be a demand for pharmacies. Now, why I'm saying so? Because if you look at it, the amount of diseases that has been reported, over the years is increasing, and the drugs which has been used to treat those diseases has now become, I would say, become resistant, in a sense that what we use for treating certain diseases may not be useful nowadays because of the resistance factor. So what we have to do is that we need to come up with new type of medicine to ensure that we really tackle that particular disease. So in those aspects, what I can say is that the demand for the pharmacy in years to come will be still there. Will be still there as long there is new diseases are coming up. People are end up with so many complications and so on. I think the demand of healthcare system will still be there, and pharmacies being the integral part of the healthcare system, I think their role is also needed. So having said that, I think we should always think, the government is always doing their best for providing better healthcare system for the nation. So in those line, I can say that the role of pharmacies will be increased, and at the same time the need also will be there. So moving forward, the number of pharmacies may be needed in a larger numbers. This is my understanding.
Which clearly comes to a situation where that the supply has to be consecutively be there. Okay, Prof. Now allow me to narrow down the funnel. Why pharmacy in AIMST?
Okay, I think it's a good question. I think I need to answer this question because there are a lot of institutions offering pharmacy program in Malaysia, and because the thing is that initially in those days only public universities were offering pharmacy program, and there were limited number of pharmacies graduated every year, and there was a demand by the healthcare sector, and that's where the public institutions came out with the pharmacy program. All right, why AIMST Pharmacy? You see, our curriculum is an integrated curriculum, and we are not looking only to produce pharmacists who will only work in hospital. No, our curriculum has been designed in such a way that when the pharmacy students completing their program, they can have option where they wanted to go. For example, if they wanted to go to the clinical pharmacy side or maybe in the hospital, our curriculum has been designed in such a way that they can go to clinical pharmacy. Now, if the students are not interested to go into a hospital pharmacy or clinical pharmacy or end up in hospital, and they prefer to go into R&D, for example, then they can go into R&D institutions or organization. They can go into this R&D organization. So for that, we need to prepare our students to have that knowledge, the theoretical understanding, finding solution for that problem, or maybe they may want to come out with a new drugs for which can give a better pharmaceutical therapeutical care and all that. So we are actually preparing the student for that aspect as well. Now moving forward, industrial need also increasing day by day. Now we are also having a kind of a structured training for our students where they will be placed in industry for 6 weeks. And these 6 weeks will be, the students will be placed in manufacturing pharmaceutical industries. So where they will be learn how the drugs will be designed, how the drugs will be manufactured in that industry, and all the process related to manufacturing. So we are really exposing our students to get the proper experience in terms of that area that they wanted to go in. And when they go out, they are kind of a ready-made pharmacists to be absorbed in any area they wanted to go in. And we also have a multiple training within our 4 years of BPharm curriculum, where we prepare the students so that when they go out, our students stood tall as compared to the other institution, simply because they have actually gone through everything. So when the students are going in, I think that our student will be more preferred because they have gone through all these experiences with them, and that will give that added advantage for our student. I would like to add on one point to that. We also send our students to India. Now, when you look at India in terms of pharmaceutical manufacturing companies or pharmaceutical per se, if you see that India is a developed country in terms of the production of medicines. All right. So when we send our students to India, our students are being exposed in internationally. So that I think is an added advantage for our students. So all these experiences, we call this prior experiential learning that we are providing to the student, will ensure that our students, will be getting whatever they wanted to be in future after completing the program. So I think the job will be guaranteed for them if they enroll into our program. So this is, I confidently I can say that.
So which means that we are giving a complete package towards people out there, Prof.
Yes.
Okay, Prof. So let me put it up in this way, which is that when we speak about this healthcare program, Prof, somehow or other the students cannot run away from the term known as medical burnout.
Okay.
Okay. So in that way, how do our faculty of pharmacy in AIMST University help out or assist the students in encountering or overcoming all these kinds of issues, Prof? Because to be very much honest, even Prof itself have witnessed that the current Gen Z, I will never use the term fragile, but they are quite sensitive, which is that they couldn't go through the actual hardship that I would say, like perhaps like the batch that Prof came from, the amount of stress, the amount of challenges that they face.
Yeah, totally different.
So in that way, Prof, how do we assist them, Prof?
Okay, now we in our faculty, our Bachelor's of Pharmacy program, we don't really only focusing on academic aspect of the program. There's a requirement that the students have to fulfill so that at the end of the day they get the pharmacy degree. But we also have multiple activities being carried out in the faculty, and we have the student society. We call the Pharmaceutical Student Society of AIMST, FAMSA. All right, this student society, they conduct various activities. All right, non-academic activities. There will be I would say every 3 weeks once there will be some activities being conducted. Now these are the activities where the students can take part, and we will ensure that all the students somehow or other will take part in all the activities being organized. So by taking part in these all co-curricular, extra-curricular activities, the student burnout, so-called burnout, will be not there because the students can balance between their studies as well as taking part in extra-curricular activities. We also conduct the public health campaigns with a topic like, for example, cancer awareness or maybe like diabetes awareness. Now, all these is extra-curricular activities where the students will involve right from planning and executing that campaign, and all the students, those involved in that, they will be going out of the university, meeting up people outside. They will feel like they are very much needed by the society because they deal directly with the society out there. So, in a nutshell, what I can say is that we structured our curriculum in such a way that both the extracurricular activities and curricular activities are being balanced. So to say the students will burn out, I don't see that. To add on to that point, Faculty of Pharmacy students are they won many prizes in the competition organized by my PSA or even other organization, and that is an evidence to show that our students are not only excelling in their studies, but they are also excelling in extra-curricular activities. So it's a kind of a balance.
Balance scheme, Prof.
Yeah,
exactly, balance scheme.
Yes.
Okay, Prof. I think while we are going on with the session itself, we have another question from the viewer out there, which is that allow me to read the comment, Prof. The intervention of AI in pharmacy. How do we see this? Because I think, Prof, the term AI itself is something that is like
people are very much hype with this terminology AI.
So what would you say, Prof?
Yeah, I agree with you, Dhiren, that and also that question, that AI, we cannot run away from AI. Everything is now being done with the assistant, whether like it or not, with the assistant of AI. So what happened now is that we are actually incorporating the AI into our curriculum as well. Now, we don't want our student to be left out when they go out, when they practice, that things are done without they understand on that medication or related to their career. So the advent of AI is actually you need to look at it whether it's helping or whether you are using it for a different for outcome, all right, different outcome. So now we need to embrace AI. No other choice, all right. So we don't want our students to to get a culture shock when they go out that AI is taking over everything in our daily life, but they are not prepared for it. So we in our Faculty of Pharmacy, we ensure that the AI component now being instilled inside the curriculum so that they know that what is the role of AI. People say that some of the jobs will be taken over by AI, right? So that the fear has been created among the general public. But when you look at it, I think AI will not take over certain jobs, all right? One of it is pharmacy. Simple reason is that you need to have pharmacies, to give a proper guidance in terms of proper medication, pharmaceutical care, and whatnot, all right? And and with the introduction of AI into our curriculum, I think our students will be benefited when they go out, that they will work side by side together with AI, using AI, and try to make sure that a better outcome, pharmaceutical care, can be given to a general public. So we are actually preparing our students to go in that line as well, Dhiren.
Prof, which means that we are keeping ourselves up to the trend of what is happening on the globe and also the nation. Because as Prof said, the intervention of AI is like, it's being hyped up, Prof.
Yep,
so
yep.
the fear itself is giving a wrong signal, I guess.
Yeah, I think, you see, because of the social media, people are getting, opinion that, AI will take over everything. But sometimes we have to be very smart in understanding what is the message behind it. And we should not, accept everything what we see in what you call the social media. But I think you need to listen to, proper channel, how the AI is really working and how it is actually helping, the professionals to help them in their career. At the same time, how they can use AI to give a better service, for whatever job that they are in now. Yeah.
All right, Prof, thank you so much. Prof, to be honest, I would like to continue the conversation, but due to the time fragment and so on, I think we have to sum up the whole podcast session. And Prof, so before we end the session, what will be Prof's message to those students who's thinking, should I choose pharmacy?
Okay, those students, waiting for their, what they call, thinking about the career and all that, I think you can bravely choose this career. Simple reason is that, you are not only going to help to, get people to get a better pharmaceutical care. And also, I believe that, there is a big future for pharmacy in the country, as well as when you go out to the globe, there's a need for pharmacies. All right, try to understand what is the role of pharmacies, has been explained earlier. And I think students, if you do not really understand what the pharmacies do normally and what kind of a job prospect is there, they can always get back to us. We are there. We can have a multiple session with them, explain to them what the pharmacist role is all about, how they can actually become a successful pharmacist in their life and all that. We are ready to serve them, Dhiren.
Thank you so much, Prof. So for those viewers out there, I think you just heard it from the right person itself. So for those who like to move into AIMST University Pharmacy Program, contact us. We are there to assist you in every way, right from providing scholarship and also assisting you throughout the whole journey. And we'll be very much happy to welcome you into AIMST University. So till we meet again on next episode, signing off from you, Dhiren from AIMST University, and have a great day ahead. Thank you very much.